If you suffer from constant foot numbness, burning soles, sharp electric shock sensations, or ice-cold deadness in your lower legs, pay close attention to this clinical warning. Neurological data reveals that peripheral neuropathy affects over 30% of aging adults after age 60, driven primarily by micro-capillary ischemia and chronic nerve compression. When tiny blood vessels feeding your peripheral nerve trunks constrict and degrade, fragile myelin sheaths are starved of essential oxygen and metabolic glucose. Without adequate oxygenated blood flow, axonal transport pathways stall, causing long sensory nerve fibers in your calves and feet to send distorted signals to your brainstem. Many seniors attempt to dull this burning discomfort using temporary nerve-numbing medications, thermal foot baths, or vibrating massagers that merely mask symptoms without restoring nerve blood supply. In clinical neurology, we recognize that peripheral nerves are living biological cables that require physical-mechanical pumping to dilate micro-capillaries and flush out metabolic toxins. When prolonged sitting or lumbar compression restricts nerve mobility, fibrous fascial adhesions bind the sciatic, tibial, and peroneal nerve trunks along your lower limb. This chronic nerve entrapment blocks ground touch feedback, causes severe loss of balance confidence, and makes every step feel like walking on thick wooden blocks or sharp pins. The encouraging medical truth is that you do not need complex medical equipment, invasive spinal injections, or heavy pharmaceutical prescriptions to awaken dying foot nerves. Neurobiomechanics proves that a specialized, surgeon-backed movement, known as the Seated Dual-Pump Neurological Glide, can immediately restore micro-capillary circulation right from your chair. By executing this simple, targeted seated movement daily, you physically flex the ankle joint and foot arch to create a mechanical pressure gradient along peripheral nerve sheaths. This rhythmic hydraulic pumping action forces warm, oxygen-rich arterial blood directly into ischemic nerve terminals, while releasing tight facial entrapment points from your knee to your toes. Instead of subjecting fragile joints to high-impact strain or aggressive stretching, this gentle seated exercise utilizes bodyweight mechanics to soothe inflamed peripheral nerve tissues safely. Within minutes of activating this clinical seated exercise, intraneural vascular resistance drops, localized burning subsides, a warm surge of circulation floods your foot soles, and feeling returns. You do not have to accept permanent foot deadness, surrender your balance stability, or live in fear of sudden tripping falls as calendar years advance. Your peripheral nervous system retains a remarkable lifelong biological capacity to repair damaged myelin sheaths, restore axonal transport, and clear neuropathy symptoms when properly stimulated. In this comprehensive senior health guide, Dr. Robbert will decode the exact medical mechanisms behind peripheral nerve ischemia and walk you through every step of this seated exercise. You will learn how to set up your seating posture, control foot dorsiflexion angles, and execute precise dual-pump movements that resensitize dormant foot sole sensors. This simple exercise takes under 5 minutes each morning, can be performed in any comfortable chair, and provides immediate sensory warmth to frozen lower extremities. By committing just a few peaceful minutes each day to this doctor-backed exercise, you can eliminate burning neuropathy, regain razor-sharp floor balance, and walk with absolute freedom. Before we demonstrate the foundational steps of this seated exercise together, let us perform a detailed medical investigation into how peripheral nerves become ischemic and starved. Let us examine how micro-capillary constriction suffocates myelin sheaths, how fascial adhesions bind nerve trunks, and how distorted signals impair balance. Grasping these biochemical and mechanical realities empowers you to take complete, educated control over your body, shielding your peripheral nerves from accelerated decay. Sit back comfortably in your chair, take a slow, deep breath, and prepare to discover the transformative seated exercise blueprint that will restore your legs and feet. In the next section, we will analyze the cellular structure of peripheral myelin sheaths and introduce the exact setup mechanics for our gold standard seated exercise. We will demonstrate how gentle heel lifts, paired with ankle dorsiflexion, pull oxygenated blood into foot-sole capillaries without placing a single pound of strain on your spine. Together, we will replace temporary Band-Aid remedies with surgeon-backed neurological restoration protocols designed to keep your legs sensation-rich, steady, and completely pain-free. No matter how many years you have struggled with numb feet or leg neuropathy, your body retains the innate biological capacity to heal when guided correctly. Let us begin this empowering journey toward total peripheral neural restoration and lifelong sensory freedom right now. To begin this life-changing seated neuropathy exercise, sit upright on the front half of a sturdy wooden chair, keeping your knees bent at 90 degrees and your feet flat on the floor. Place your hands comfortably on your knees or the sides of your chair, maintaining a tall, decompressed spine without leaning backward or slouching against the chair back. The first movement phase focuses on the posterior tibial pump. Keeping your toes pressed firmly against the floor, slowly lift both heels as high as comfortably possible, contracting your calf muscles. This deep calf contraction compresses the soleus and gastrocnemius muscle pumps, squeezing the posterior tibial artery and propelling oxygenated blood through the tarsal tunnel behind your inner ankle. Hold this peak heel lift position for 1 full second, feeling a firm, warming contraction along your lower calf, then slowly lower your heels back to the floor. Immediately transition into the second movement phase, the anterior peroneal glide. Keeping your heels anchored firmly on the floor, lift your toes and forefeet upward toward your shins in deep dorsiflexion. This sharp forefoot elevation engages the tibialis anterior muscle and pulls the superficial peroneal nerve taut along the front of your shin, releasing fascial compression across your foot instep. Hold this peak toe lift position for 1 full second, feeling a gentle lengthening sensation along your shin and top of your foot, then lower your forefeet smoothly to the floor. Combine these two distinct phases into one continuous fluid alternating piston motion. Lift heels up, lower heels down, lift toes up, lower toes down. Perform 15 controlled alternating repetitions, matching each upward movement with a deep, calm inhalation through your nose, and each lowering movement with an exhalation through your mouth. As you maintain this rhythmic dual pumping action, a powerful hydraulic wave of oxygenated arterial blood rushes into the micro-capillaries, nourishing your foot soles. Feel an immediate, deep warming sensation spreading through your heel pads, mid-foot arches, and into the very tips of your toes as ischemic nerve sheaths rehydrate. Pause for a slow, deep breath. Relax your lower legs for 10 seconds and execute a second set of 15 controlled alternating pumping repetitions. This targeted dual pump action physically breaks up microadhesions inside the tarsal tunnel, lowers intraneural tissue pressure, and stimulates dormant Pacinian touch receptors in your skin. For maximum neurological benefit, execute 2 sets of this seated dual pump exercise every morning upon waking and every evening before preparing for sleep. By mastering this simple seated exercise, you take direct control over your lower leg circulation, flooding starving nerve fibers with vital oxygen and glucose. Let us now prepare to explore the secondary microactivation interval, engineered to enhance foot arch flexibility and sharpen spatial balance reflexes. In the next section, we will analyze how pairing seated ankle pumps with intrinsic toe curling reactivates long-dormant sensory feedback loops in your feet. We will also demonstrate how properly oxygenated peripheral nerve sheaths restore balance confidence, allowing you to walk without feeling disconnected from the floor. Eliminating micro-capillary ischemia through controlled mechanical pumping provides your peripheral nerves with the ideal biological environment to repair and resensitize. By committing to this surgeon-backed daily routine, you protect your legs from progressive numbness, prevent fall hazards, and preserve your physical independence. Together, we will continue replacing temporary nerve remedies with clinical movement protocols designed to keep your feet warm, sensation-rich, and completely pain-free. No matter how many years you have suffered from numb feet or leg neuropathy, your body retains the biological capacity to heal when guided correctly. Let us advance to the next phase of our neurological restoration protocol and unlock the foot-sole sensory activation interval right now. After activating the primary posterior tibial artery and calf pumps, we must target the distal nerve endings in your foot arches and toes. Below your ankle, the tibial nerve branches into the medial and lateral plantar nerves, which weave through the intrinsic muscle layers of your foot sole. When micro-capillary ischemia starves these plantar nerve branches, sensory signals from Pacinian and Meissner corpuscles become completely blocked, leaving your foot soles feeling wooden and dead. To perform Phase 2 sensory activation, maintain your seated posture, lift your heels slightly, and execute 10 controlled toe curling and toe spreading cycles. As you lift your heels up, curl all 5 toes tightly inward against the floor, contracting your intrinsic plantar flexor muscles to squeeze the plantar nerve plexus. As you lower your heels and lift your forefeet upward, spread all 5 toes wide apart, stretching the plantar fascia and releasing trapped digital nerve branches. This alternating toe curl and toe spread motion acts like a localized micro-piston, propelling oxygenated blood through tiny arterioles directly into starved nerve terminals. Feel an immediate, deep surge of biological warmth spreading through your midfoot arch and radiating into the very tips of your toes as circulation restores. Pause for a gentle breath, relax your feet, and repeat this 10-cycle toe activation sequence to ensure thorough micro-capillary vasodilation across both feet. This dual-action sensory activation accelerates the clearance of ischemic metabolic waste, reduces intraneural fluid pressure, and resensitizes dormant touch receptors in your skin. With skin touch sensors fully reactivated, your brain receives instant, crystal-clear feedback regarding floor texture, weight distribution, and step stability with every step you take. By combining primary seated dual pumping with secondary toe spreading, you establish a complete biological loop that protects your entire lower leg from progressive sensory loss. Let us now prepare to analyze the 5 dangerous daily mistakes that quietly crush your lower leg nerves and cause burning, tingling, and neuropathy to return after age 60. Many well-meaning seniors inadvertently starve their peripheral nerves through improper sitting postures, restrictive footwear, prolonged immobility, or improper thermal habits throughout the day. Identifying and eliminating these 5 silent nerve hazards guarantees that every minute you invest in your seated exercise routine delivers permanent, long-lasting sensory recovery. In the next section, Dr. Robbert will break down these 5 critical lifestyle errors in detail and provide simple, surgeon-backed daily corrections for each one. We will also integrate these clinical safeguards with our seated dual-pump exercise into an easy-to-follow 30-day action blueprint for your daily morning and evening schedule. Together, we will continue replacing temporary nerve remedies with clinical physical restoration protocols designed to keep your legs feeling vibrant, warm, and completely pain-free. No matter how many years you have struggled with numb feet or leg neuropathy, your peripheral nervous system retains the biological capacity to heal when guided correctly. Let us advance to the next phase of our neurological restoration protocol and explore the critical nerve safety rules together right now. The first critical lifestyle mistake that quietly crushes your lower spinal nerve roots is sinking into deeply cushioned, overly soft armchairs that collapse your pelvis backward. When your pelvis tilts backward on a soft couch, your lumbar spine flattens and flexes forward, dramatically increasing internal hydrostatic pressure inside your L4, L5, and L5S1 intervertebral discs. This continuous posterior disc bulge directly pinches spinal nerve roots, cutting off axonal blood supply and sending intense burning or numbness down your sciatic nerve pathways. Always sit on a sturdy, flat-seated chair that supports an erect spine, placing a small lumbar cushion behind your lower back to maintain your natural inward spinal curve. The second major error is habitually crossing your legs at the knees or ankles while sitting for long periods throughout the day. Crossing your legs places direct mechanical pressure on the fibular head just below your knee joint, crushing the superficial peroneal nerve against hard bone. This localized nerve compression cuts off micro-capillary blood supply to peripheral fibers, causing your outer calf and top of your foot to go completely numb within minutes. Keep both feet planted flat on the floor with your knees uncrossed, keeping your hips and knees in neutral alignment to ensure open, unobstructed neural circulation. The third critical error is wearing tight elastic socks, restrictive ankle bands, or narrow shoes that create a physical tourniquet around your feet. Tight elastic bands restrict superficial micro-capillaries, supplying blood to cutaneous nerve endings, starving peripheral myelin sheaths of essential metabolic oxygen and glucose. Choose loose-fitting, non-binding diabetic socks and wide toe box footwear that allow unrestricted capillary blood flow to your lower extremity nerves. The fourth major mistake is soaking your numb feet in scalding hot water under the false belief that extreme heat will wake up dead nerve endings. Because peripheral neuropathy blunts heat-temperature skin receptors, scalding water can cause severe thermal burns and tissue damage without you feeling any initial pain signals. Always test water temperature using your wrist or forearm before soaking your feet, ensuring water remains comfortably warm rather than dangerously hot. The fifth critical error is remaining completely sedentary for hours, allowing venous blood and lymph fluid to pool around your ankles and tarsal tunnel. Fluid accumulation inside your ankle joint increases tissue swelling, squeezing the posterior tibial nerve inside the narrow tarsal tunnel and worsening foot numbness. Perform 10 gentle seated dual pumping movements every hour during prolonged sitting to keep calf muscle pumps active and prevent lower leg fluid accumulation. By eliminating these 5 dangerous lifestyle errors, you instantly remove the primary mechanical barriers that choke off blood supply to your peripheral nerves. Combining sturdy seating, uncrossed legs, loose footwear, safe water temperature, and hourly seated pumping creates the ultimate internal environment for complete nerve restoration. In the next section, we will integrate this gold standard seated exercise into a seamless 30-day clinical action blueprint for your daily schedule. You will learn how to structure your daily morning and evening habits to achieve maximum nerve root decompression, myelin sheath rehydration, and permanent relief from neuropathy. Together, we will continue replacing temporary nerve remedies with surgeon-backed physical restoration protocols designed to keep your legs sensation-rich, warm, and completely pain-free. Welcome to the fifth phase, your complete 30-day clinical action blueprint to permanently reverse foot and leg neuropathy through seated exercise. In clinical neurology, short, daily sessions of mechanical micro-capillary pumping are exponentially more effective than sporadic, aggressive stretches that irritate fragile nerve sheaths. Begin every single morning immediately upon waking by drinking a tall glass of fresh room temperature water to rehydrate your intervertebral discs and blood volume. Sit upright on a sturdy wooden chair with your feet flat on the floor, locking your spine in decompressed neutral alignment. Execute 15 smooth repetitions of primary seated dual-pump ankle glides, alternating high heel lifts with deep toe dorsiflexion to force blood through nerve sheaths. Follow immediately with 10 cycles of secondary toe curling and toe spreading microactivation per foot, driving oxygenated blood directly into foot sole mechanoreceptors. This complete seated routine takes under 5 minutes each morning, establishing an unshakable foundation of open nerve pathways and continuous circulation for your day. Throughout your daily afternoon activities, maintain conscious posture awareness, avoiding soft slouched couches and keeping your legs uncrossed while sitting. Set a gentle hourly reminder on your phone to perform 5 quick seated ankle pumps, preventing fluid accumulation inside your tarsal tunnel. In the afternoon, enjoy a light, anti-inflammatory meal rich in B-complex vitamins, dark leafy greens, and antioxidants to support peripheral nerve tissue repair. During your evening unwind time, Perform a gentle 5-minute refresher set of seated ankle pumps before relaxing comfortably with your feet elevated slightly. Prioritize 7 to 8 hours of restful sleep every night, as axonal transport and myelin sheath regeneration peak during deep sleep cycles. Within the first 7 days of adhering to this daily blueprint, you will experience a dramatic reduction in persistent toe numbness, burning, and nighttime cramping. Between days 8 and 20, as nerve sheath inflammation subsides and intraneural circulation accelerates, your foot sensitivity and floor awareness will sharpen significantly. By day 30, fully oxygenated peripheral nerve trunks and rehydrated myelin sheaths will empower you to walk with steady balance and total sensory confidence. Always remember that neurological recovery is a continuous biological journey that rewards gentle, consistent daily care rather than sudden, sporadic overexertion. Listen attentively to your body's subtle signals, honor your daily physical progress, and take deep pride in every sensation-rich, confident step you take. Let us now transition into our clinical Dr. FAQ section, addressing the most critical, frequently asked questions about neuropathy, balance loss, and foot health after age 60. Our first essential question addresses whether seniors with long-standing diabetic peripheral neuropathy can safely practice this seated dual pump exercise. Dr. Robbert will explain why mechanical ankle pumping actively dilates micro-capillaries, delivering vital oxygen and glucose to oxygen-starved diabetic nerve sheaths safely. Our second question explores whether foot numbness caused by lumbar spinal stenosis, or sciatica, can improve through seated lower leg pumping. Dr. Robbert will clarify how seated axial decompression, combined with ankle pumping, releases trapped nerve roots at L4-L5 while restoring distal blood circulation. Our third question tackles how to distinguish between healthy, warming circulation sensations and dangerous sharp warning pain during your daily seated exercise routine. Dr. Robbert will share simple, actionable sensory rules to help you navigate your recovery safely without ever risking joint or nerve irritation. Welcome to the final phase of our Neurological Restoration Masterclass, where Dr. Robbert answers your remaining clinical questions and provides your complete sign-off roadmap. Our fourth Dr. FAQ question asks, can seniors suffering from restless leg syndrome or nocturnal foot cramps safely practice this seated dual pump exercise? Dr. Robbert explains that seated ankle pumping actively flushes accumulated metabolic waste and lactic acid from calf muscles, making it exceptionally effective for soothing nighttime leg restlessness and preventing sudden painful cramps. By executing 2 sets of 15 smooth ankle pumps right before getting into bed, you optimize venous return, relax peripheral nerve tension, and ensure peaceful, uninterrupted sleep throughout the night. Our fifth FAQ question addresses whether you should perform this seated dual pump exercise barefoot or while wearing supportive footwear. Performing the exercise barefoot or in soft, non-binding socks allows full range of motion for intrinsic toe curling and spreading, maximizing sensory input to skin touch receptors. However, if you feel cold or require arch support while seated, wearing loose, flexible footwear is completely safe and still delivers full micro-capillary pumping benefits. Our sixth Dr. FAQ question tackles tempo and intensity. Should seniors pump their ankles as fast as possible to build circulation quickly? Dr. Robbert strongly warns against rapid, frantic pumping movements, which can cause calf muscle strain and trigger protective nerve tightening rather than relaxation. Focus entirely on smooth, controlled, deliberate movements, holding peak heel lift and toe lift positions for 1 full second to maximize intraneural blood flow. Our seventh FAQ question asks how quickly seniors can expect to observe visible reductions in foot numbness, burning sensations, and tingling discomfort. Most aging adults report immediate warming sensations and noticeable relief from acute foot deadness within 48 hours of beginning daily seated dual pumping. Significant improvements in foot floor sensitivity, standing balance stability, and sensory clarity typically materialize between days 14 and 21 of consistent practice. By day 30, your peripheral nervous system locks in these restored conduction pathways, giving you steady balance, warm sensation-rich feet, and renewed mobility confidence. As we conclude this clinical neurological guide, Dr. Robbert wants to leave you with a message of biological hope, personal empowerment, and sensory resilience. Never accept the harmful myth that dead numb feet, burning toes, cold legs, or unsteady wobbly balance are unavoidable consequences of growing older. Your peripheral nerves, spinal cord nerve roots, micro-capillaries, and sensory mechanoreceptors retain an extraordinary biological capacity to adapt, rehydrate, and resensitize at any age. By replacing temporary nerve-numbing creams with this surgeon-backed simple seated exercise, you systematically resolve the root cause of micro-capillary ischemia right from home. Commit just 5 peaceful minutes every morning and evening to pumping your ankles, flexing your toes, and driving oxygenated blood into your foot nerves. Listen attentively to your body's subtle sensory signals. Celebrate your daily progress, and take immense pride in every confident, sensation-rich step you take. Share these life-changing neurological secrets with your family, friends, and community to inspire everyone around you to live active, neuropathy-free lives. You now possess the complete clinical biomechanics, the gold standard seated exercise, the daily 30-day action blueprint, and expert doctor guidance required to restore your nerves. Take charge of your neurological health today. Pump your calf muscles, untrap your tibial nerve, awaken your foot sensors, and reclaim the vibrant life you deserve. This is Dr. Robbert, wishing you radiant physical health, resilient nerve pathways, warm, sensitive feet, and a steady, confident stride every single day of your life.